Let's talk about what you need to do or what the process is for injecting yourself once you get one of these vials of GLP-1s in the mail. My name is Dr. G and I'm an internal medicine physician in Hollywood, Florida, and I'm also a lifestyle modification coach, a patient education specialist, and also an expert in GLP-1 agonist medications. We do this here in the office for our patients, and that, by extension, makes us pretty much experts at injecting this stuff and how to figure out how much and how to do the process here in the office. And we teach our patients how to do this as well when they transition over to now, for example, Lilly Direct has their own direct pharmacy where the patients can pay for the medications directly and the meds come to their home directly. And funny enough, they're not inserting any type of directions for patients, and they still have confusion and end up bringing the medications back, and we have to teach them what to do, how to measure it, what injection spots they need to put them in, and all that stuff. So that's what we're going to do here. Give you a quick view and quick idea how to manage this stuff when it comes in. I know it's not very common for here in the United States for us to get injections or to send prescriptions for injections for our patients at home. So this is what you get. You'll get a vial of medication, obviously, and on the vial, it'll tell you how many milligrams is in the vial, and underneath that, there's going to be a slash. It'll say, like, for instance, this one is Tirzepatide, 10 milligrams slash ml. It'll say per ml. So there's 10 milligrams for every 1 ml inside this vial, and there's a total of 1 ml, so there's 10 milligrams in here. When you get your meds, usually from any compounding pharmacy or Lilly Direct or whoever else, whatever company else is going to be doing this, because I'm sure other companies are going to jump on, you will typically get a syringe. And it's weird because they send the insulin syringes, which are abundant, and I think that's why they send them, and they already have on them, well, we can open up this one in a moment, and you'll see on this orange cap here, it has already, the actual needle is on here, and this one is already loaded up with a 29 gauge, 1/2 inch needle, which is almost impossible to get into the intramuscular, but you can if you really try. So that 1/2 inch is pretty much everyone's subcutaneous space, which is where you want to put the medication. So it's almost foolproof. You got to be careful and make sure you put it in the right place. Or they'll give you a syringe like this one, which is in milliliters. It's not in units. The insulin syringes come in units, and it goes 10, 20, 30, 40, 50, 60, 70, 80, 90, 100, right? Usually. And I'm going to give you a caveat in what I saw this week, which is kind of weird, and I don't know why they did it, but they did. Anyhow, here we also have the other option, which is a 1 ml syringe, and it also has its lines, and it's 0.1, 0.2, 0.3, 0.4, 0.5, 0.6, 0.7, 0.8, 0.9, and 1 ml. So if you pull the plunger back all the way, I would be able to pull out the whole thing of Tirzepatide here, and I would have 10 milligrams loaded on the syringe, and I can inject this in the subcutaneous space. The difference is I have to put on another needle. This is a 30 gauge, 1/2 inch from our office. So we put it together and we can draw and inject if we want, right? So those are your two options. Either you get the separated 1 ml syringe with a 30 or 32 gauge needle that you'll have to put together, which is kind of tricky as well, for people who don't do this all the time. Nurses and doctors do this all the time. You would put it together and turn, like a 90-degree turn. It's going to be pretty tight, and it's on there so it doesn't get loose. And then you can pull the medications and inject yourself with that. So the needle is already on there. Like I said, it's a 29 gauge, 1/2 inch. So, and it's not going to come off. It's on there, right? It's stuck. It's together. It's not detachable like this one. So you take off the safety cap, put it into your vial, pull back the amount of medications that you need, and inject. Now, another difference, units. This is where people get thrown off. Every 10 units is 0.1 mLs. So 100 units is the whole ml. 10, 20, 30, 40, 60, 70, 80, 90, 100 is 0.1, 0.2, 0.3, 0.4, 0.5, 0.6, 0.7, 0.8, 0.9, 0.10, 10, right? So these are equivalent. But the confusion is when they tell you, hey, put in 30 units. And your friend is putting in, put in 0.3 mLs. That's the same thing, but it sounds so wildly different. Like 30 is a bigger number in our brains. 30 units sounds like a bigger number than 0.3, but actually you are saying the same thing, because every 10 units is 0.1 ml. So 0.3 milliliters is actually 30 units. Exactly the same thing. 0.5 milliliters, mLs, is 50 units. It is what it is. I didn't make this up, and it is what it is. So this is why, one of the reasons why we're talking in a comment section or I'm speaking to patients, I do not speak in terms of milliliters or units because there's a lot of confusion. Let's talk about how many milligrams you are expected to put into your body, or they're asking you, your doctor, the compounded pharmacy says you're supposed to get, you were referred, you were on before, because if we start talking about mLs and units, not to mention that these vials come in different concentrations, we're gonna speak different languages. It's like speaking, German and Italian and French and Spanish and English all in the same room, and no one knows what anyone is saying, but we're all maybe saying the same thing. So very interesting that we're bringing this up in this space now, because it's become an issue, because this has become so common, right? So when you're talking about the medications, do your best to continue to always relay how much you're injecting in milligrams. That way, whoever's helping you, me, someone else, nurse, whatever, friend, they know, they say, well, how many milligrams is in your vial? Okay, well, how much is the fluid? So no, you need 0.2 milliliters to make this work. You need 0.2 milliliters in order to get the amount of milligrams you need. If you want to get out of this vial, we have 10 milligrams in 1 ml, so 20 units. If I wanted to get 2 milligrams of Tirzepatide, or 2.5. So let's do 2.5 milligrams, because that's a standard dose. 2.5 milligrams out of this vial will be 25 units. So that's 0.25 mLs. Here, 25 units is 0.25 mLs, right? So just remember, every 10 units is 0.1 mLs, and obviously 0.1 mLs here. And all you need to know is how many milligrams and how much fluid you have in here so you can pull it out. Now, I would think the best thing to do, if I were a manufacturer or a compounding pharmacy, is to include an insert with instructions every single time. Believe it or not, got a patient in here last week and he was super confused because not only did it not include instructions for the conversion for him in the box, but they also sent him a weird insulin syringe. It was 50. It was a 50 ml syringe and needle. It was really weird. I mean, weird to the patient, because now you're like, well, I usually 100, and it makes a lot of confusion, but I guess that's what they had on hand. It doesn't change anything. He had a 10 milligram vial, so he needed half of it for 5 milligrams. So it's the 50 ml. So for every 10 units is 1 milligram. So 1, 2, 3, 4, 5, 50 mLs is 5 milligrams. So you just really need to just do the whole thing, but they gave him no instructions. I mean, you can't assume that the layperson understands exactly how to do this. So just so you know, it can happen. So you have to understand the basics, which is, like I said, one last time, every 10 units equals 0.1 mLs. And obviously on this one, it says 0.1 ml. So if this is a milliliter syringe and it's 1 ml, it'll be broken down into 0.1s, and you need every 0.1 is 0.1, and for this is 1 milligram. So I hope that's clear. The most important parts are just knowing if you get an insulin syringe, every 10 units is 0.1 mLs. Now we're gonna set this up. I'm gonna go ahead and pull out some medication here. I'm gonna reset the camera and get some injections going. So here we are with the setup. I've got the syringe that I was telling you about. This is a 1 ml syringe. So this is an insulin syringe. And this one comes in units, 10, 20, 30. And then, like I said, this end is the needle end, and it's on there. You can't take it off. It's fixed. So that's how you'll get it. You get it like this. All right, so every time you put a syringe through this rubber stopper here, it's on the top of this cap of this vial, right? This is your vial. It gets a little dull. So if you're not getting the right amount the first time and you're using this fixed needle on this syringe and you're having to do it multiple times to get it right, or if put it in, you weren't sure, put it out, you go back and forth, you're gonna make that needle dull. And the more dull you make that needle, and since it's fixed, you have to put this into your body. When you do that, it may hurt. It may get, the duller it is, the harder it is to put it into your skin, and it's just more trauma to your skin, and it may hurt. So if you are getting these fixed ones, just make sure that you minimize the amount of times that you have to go in and out of this rubber stopper before you inject yourself. That's just a pro tip. You're not gonna ruin anything, but it's just gonna hurt more. As opposed to this one, if you do go multiple times in and out, pull out this 30 gauge, 1/2 inch syringe, and you put this on, like I said, and you twist it about pretty much like a 90-degree turn. Then you pull this off. You can see the needle here. Give it something to look behind. Yeah, there we go. So, see that needle? I tend to find these are a little bit sharper than the insulin syringes for whatever reason, but just a bit of a higher quality, I would say. Regardless, you could probably go a couple times through the syringe, the rubber stopper on this, but still same principle. If you go through that rubber stopper too many times, it's going to make it really, really dull, and it's going to hurt. So those are the two different types of syringes that you may get, and this one obviously is detached. It comes like that. Put it on. Just make sure it's on there, right? It's on there, good. And then you can pull this off straight. Don't want to get all herky-jerky with it because then you can hurt yourself, right? And it's on there, right? So that's this setup, and this is the more, I'm finding this is to be the more common setup. And even with the Lilly Direct, which is sending, for whatever reason, weird, like I said, they're sending, along with the compounded medication they're selling, a 50-unit syringe. Whatever. Same thing, that it's still 0.5 mLs, which is 50 units, 0.5 mLs, and that's what you're injecting to get 5 milligrams out of that 5 milligram syringe. It's in there, it's just, the same concentration. So anyhow, let's go ahead and pull out, this is 10 milligrams of Tirzepatide and 1 mLs of fluid. So we're going to do a quick swipe of the cap. Let's pull these stuff out of the way. We're gonna actually pull out for two different patients. I'm gonna show you what 2.5 milligrams looks like here, which is 0.25 milligrams, or 0.25 mLs is 2.5 milligrams. And then I'm gonna show you what 5 milligrams looks like 50 units in the insulin syringe. We have two different patients ready to go. So here we are, let's do it. Quick wipe of the cap, just because it's open, and to the air, you don't want to introduce anything into the vial. So you can just pull back a little bit, maybe like halfway of what you're going to do. So in this case, we're going to pull out to about 25 units of air. Push that in there, and then pull back our 50 units. There we go. Still pulling back, still pulling back. Take those 50 units, and you're going to push back. You're going to pull, put it in there, and you pull back till you get 50 units, and then you can push until you actually get that rubber stopper, the black stopper, right on the 50, and then you can pull it back and pull it out. There you go. Really hard with these clear, these quote-unquote smart cameras and stuff. But anyway, we pull back, and we've got 50 units loaded on here on the syringe. Okay? So I'm going to recap this. So this 5 milligrams of Tirzepatide is ready to go. Now, I'm going to use the 1 ml syringe that's in partitions. There goes 0.2 mLs, there's 0.25, that's 0.3, all the way back to 1 ml, which would, in this case, be the whole 10 milligrams, but we just pulled out 5 milligrams, so there's only 5 milligrams left in here. So here we go. We're going to pull back and get 0.25 for this patient, for this other patient. So pull that, ready to go. We can go in. You got to be very careful because these needles are super, super thin. So if you don't do it straight in, you may bend the needle. So here we go. Pull back and get 0.25 mLs. All right, so we push it and you put it half, obviously 0.25 is going to be halfway between 0.2 and 0.3. So you push it back in and get it right to 0.25, right? And for this vial, this is 2.5 milligrams. So we have 50 milligrams in here and 0.25 in here. Cap this. Here we go. We got 50 units, which is 5 milligrams of Tirzepatide in this one, in the insulin syringe, which is 50 units, and 0.25 mLs, which is 2.5 milligrams of Tirzepatide in the milliliter, 1 ml syringe. Both are pretty much the same size needle. Pretty much the same size needle. There's really no big difference between the two. Very hard to see them. That's how small, that's how skinny they are, you know, really, really thin needles. They are, here we go, that's capped and this one's capped. Now that our meds are ready to go, we can go into the exam room and inject our patient. Okay, so here we are with our patient, the lovely Miss Stephanie. You probably have seen her on the previous video where she showed us and talked to us about her amazing transformation with all the lifestyle changes that she's made, and she's now on maintenance doses. So she is going to be our model today for the appropriate way to inject the GLP-1 agonist after getting your dose out of the vial. So the three places where the medications are approved for injection are behind the arm, here, typically about 2 to 3 inches underneath, below the deltoid or above the elbow. So in this area is the zone that we're trying to put it. Or in the upper thigh, here, from here to here, or in the belly on either side of the umbilical button. Yep, so she is one of the patients that like to get her injections in the umbilical area, and that's where we're gonna inject her now, okay? So first, thank you. She's a pro, so she knows exactly what we're doing. We wipe the area. And grab the belly and inject the dose. And that's it. Pretty simple. Anyone can do it. If you do it the right way, it won't be, shouldn't be painful. Sometimes you will have a little bit of redness in the area. Other than that, you shouldn't feel anything else. So that completes how to draw up and inject your GLP-1 agonist from the vial. Stay healthy, stay informed, and I'll see you soon.